Oh, Dr. Albert,
Hi, Dr. Zheng. How are you?
I know you are a good sleeper, right? How many hours you sleep
Yeah.
every day?
Well, I think most people should try to get 7 to 9 hours of sleep
7 to 9,
per night.
yeah.
So,
But so many people have sleep issues, interrupted sleep, hard to fall asleep. And I had that problem since I was 17 years old. So I have to work very hard to keep my nerves at a relaxed state. So if I talk to somebody at night, then either I don't fall asleep or I finally fall asleep, then my sleep depth will be changed, and then I keep waking up and dreaming, and so the next day, even I stay in bed for 7, 8 hours, I was tired.
yeah, I think so. There's a difference between time that you're asleep and
Yeah.
the depth of the sleep that you
Yes.
get, right? So people want to hit those deeper levels of sleep where they're dreaming,
Yes.
more often, because then you get more restful sleep and your body can do its cleaning that it needs to do.
Exactly. So my experience is, you have to really balance the nervous system. So before I go to bed, I take 2 hours to prepare. I don't talk. Even watch movie can stimulate my brain. I don't watch news, and then I'll do stretching. I sometimes listen to the scientific research, which is kind of not stimulating. And what did you do?
So, I mean, yeah, usually you want to take away screens, within an hour or a couple hours of bedtime. A lot of people use their phones, which have bright lights and are very stimulating with a lot of different videos kind of going by. And so you want to put that away, try to read a book or do something that's more relaxing.
I think the iPad is different from reading a book. So I find if I read a real book, I feel more relaxed, and after 10, 15 minutes, my brain just shut down.
Right. And the Kindle is, and those types of, tablets are built to have lower light, to not affect your brain receptors as much. I mean, people have heard about like blue light filters in glasses. That's because sometimes the blue light from the screens can affect your sense, of time and melatonin production in the brain to help you be like, what's the word? To help you be like correlated with the time of to help fix your circadian rhythm.
Yes, yes.
We can add in.
Yes, I think sleep can be related with. I mean, there's so many factors, and not only melatonin, the serotonin can make your sleep deeper, and GABA and histamine can make you sleep less deeper. So, like for me, I tried a different kind of supplements. Like melatonin never works with me, and antihistamine, like Benadryl, I can take one capsule for 2 nights. It works. And then the third night it stopped. But the most effective way, and any kind of sleeping pill, if you continuously take that for a couple of days, then it loses the effect unless you bring up the dosage. So to avoid that sleeping pill long-term usage, you really have to have a sleep hygiene to follow the protocol. Your body can maintain sleep for 6, 7 hours.
Right, and medicines like Benadryl can really affect your memory over time. So, a lot of times people take medicines or supplements to help them sleep, but then long term that affects their ability to recall things, short-term memory and to do simple tasks like simple math.
Yes, yes. But how do you think coffee? Do you ever drink coffee?
I don't drink coffee, but sometimes I'll have tea, rarely.
Not everyday tea.
No. No, but most people drink coffee every day. But if they have it early enough in the day, then it shouldn't really affect their sleep.
Yeah, it affected me. Even I drink
depends on
one
the person,
quarter.
right?
Yes, exactly.
And some people drink energy drinks all day long, right? And those have a lot of caffeine in them.
Yeah. So talking about the nerve activity, if you stimulate the nerve too much, the nerve will die. First, the nerve get firing up at higher level, and then it lose the function gradually. So the nerve inflammation could happen in every parts of the brain like so let's see, what is this called? Gary-Barry syndrome? Yeah.
Oh, you're talking about beriberi syndrome.
Yeah. So when people don't sleep for a prolonged time, the nerve get hyperactive, and then it causes inflammation. So it can lead to different kind of dysfunction of the nerves.
And I think that can be associated with alcohol.
Yes.
If I remember.
What do you think? Alcohol just numb the nerves or stimulate the nerves? Because when I drink alcohol, I try to test that, and I thought I get a palpitation.
Well, some people have an opposite reaction, but for most people, it calms down the nervous system. It stimulates GABA receptors, which help block the activity, overstimulation of the brain, and helps calm down the nervous system. And that's why we usually start with magnesium supplements to help with sleep also, because magnesium helps open up those GABA receptor channels, right?
Okay. So, but people who drink alcohol, the next day they don't feel well, right?
Right. So, yeah, alcohol is not a great thing to rely on.
But
for
let's
sleep
say,
or
comparing alcohol and medicine, which way you think it would be less detrimental to the body?
I think long term, usually medicine, but it depends on which medicine you're talking about. And some medicines are going to be a lot stronger than alcohol, where they cause dependency, similar to alcohol, but maybe even to a higher extent, where you need to be taking them for the rest of your life. It can change the receptors in your brain permanently or long term, depending on how many years or decades you're on these medicines. And it can be very difficult to come off of them. People get withdrawal symptoms.
Why? See, Ambien is a very safe medicine, because that guy Murdoch, that guy who scammed so many people, he took the whole bottle of Ambien to commit suicide, but he didn't die, and he still survived. He lived up to over 90 years old, even though his child committed suicide. But why there is a restriction on prescription of Ambien? What's the?
Well, it's considered a controlled substance because people can become dependent on it. And they can need higher doses to get the same effect over time. So because of that addictive potential, it's considered a controlled substance. Even testosterone is considered a controlled substance.
Oh, testosterone?
Because if you take it, then your body may stop producing its own, and so you can become dependent on it long term. So that's why it's considered controlled. Ambien can make people sleepwalk, though. So, for some people, it may not be safe because of that. Okay. There's a newer class of medications that came out, I think, about a few years ago, orexin antagonists like Qvivic and Belsomra, that seem to be safer, but there's not as much data because they're newer and they're extremely expensive. So most people can't afford those medications because they're still under their patents, right?
How about a trazodone? Because there are a lot of older people, and even my son, when he said he couldn't sleep well, and then the PCP will give trazodone. But I think trazodone causes a lot of drowsiness for older people.
Right. I mean, it depends on the person, but typically for medicines, trazodone is used off-label, mirtazapine is used off-label. Sometimes even Seroquel, can be used, and that's a little bit stronger. And those are not controlled substances, but they do alter the brain chemistry. Right? So I prefer to start with natural things like magnesium, chamomile, valerian root, passion flower.
Did you ever try the ashwagandha?
Ashwagandha can help. I'm actually allergic to ashwagandha, but for most people it can help them, decrease their anxiety, lower salivary cortisol levels potentially, and help with sleep. So I think it's fairly safe for most people. It can affect the liver. If someone has liver disease, you have to be careful.
The ashwagandha?
For ashwagandha.
Oh, it can. So probably high dosage would be not safe.
Right.
Do you think melatonin take long term? I mean, it doesn't work for me, but people think it's very safe taking, like 1 milligram is low dosage. Some people take a 3 milligram, 5 milligram. Do you think long term, it's also serve as a hormones, right?
Right. So melatonin and your cortisol, the cortisol producing hormone in the brain that stimulates cortisol production.
It's stimulated?
It's
a precursor?
So the precursor, so corticotropin, of the precursor that causes stimulation of cortisol production in the body.
Yes.
And melatonin share the same precursor, pro-opiomelanocortin.
Okay.
So when you're stimulating melatonin, then I think you're probably blocking that pathway a little bit, right? Of melatonin production and the stimulation of cortisol potentially too.
Okay.
So it probably depends on the individual.
Like a cross-link, right?
They're cross-linked.
Yeah.
I think it's fairly safe for most people to do long-term. I only recommend it if someone really needs it and it works for them, right? I prefer to use a lot of natural things and prefer to use things intermittently rather than every single day, right?
That's right, yes. And the thing is, if you occasionally use medication or use herbs for a couple of months, once your stress level lowered, you sleep better, and then you stop, then you can resensitize the receptor, right?
Right.
Yeah, but
so,
if you continue to use that, then your receptor just desensitized, and then you have to go higher dosage, right?
Right, and then it can take a year or years for your receptors to recover from that sensitization, right, and get back to their state that they were before you ever started taking the medication. So it can be very difficult for people coming off of a lot of these really strong medicines. It's very difficult.
Yes.
There's a lot of dietary things people can do, like lotus root. I was reading about the other day.
Lotus root,
it can help with sleep and getting deeper levels of sleep, which is very interesting.
Yeah, lotus root was in Chinese formula, and we use that to strengthen the gut lining, improve the gut health, and also it has a calming effect. So I think the modern research verifying that it can help sleep, calm down the nervous system. And also acupuncture, for some people, it really helps them to go into sleep and stay asleep. And it's very individualized, because I recently trained a guy from Colombia. I think they won the soccer ball game, World Cup. And I tried to treat a sleep apnea for this guy. And he responds so well, because I was doing the electric stimulation here to strengthen the muscle around the palate, so that it won't completely drop when he was lying on back or lying on the side. So, and I thought it's quite stimulating, the electric stimulation. And then, but it really helped him sleep. He can sleep through the night.
There is a medical device too that people can wear on their tongue to help stimulate the muscles of the tongue, and it's a treatment for sleep apnea also.
Yes.
That's interesting. Only for mild cases, though.
Yes.
Right? The more severe cases generally need a machine, a CPAP.
The CPAP machine?
Yep.
Okay.
CPAP or BiPAP at the most severe.
But see, this guy has no phlegm. Usually if you have phlegm, you have inflammation, then when you sleep, you completely block your airway. He has no phlegm, and the physician said, his palate completely blocked the airway when he was in deep sleep, but he couldn't tolerate the machine. So that's why I was trying to do the stimulation here. And I also like certain movement, like setups and to tone the muscle here would potentially help.
Yeah. I think a lot of people have difficulty getting the number of hours of sleep that they need because they're too busy with work and with kids or whatnot going on in their lives. So for those cases, generally I recommend that they take a nap during the day if they can, or at least try to catch up on the weekends, because you can make up for lost sleep.
Yes.
During the week on the weekends also.
Yes. Sleep is the best medicine, right?
Right.
Yeah.
Your body needs it to recover and heal, and people who have chronic sleep issues, I think, develop other problems like chronic pain, maybe fibromyalgia or neuropathy or other issues, because they're just not cleaning their body properly, every night, and it just builds up over time.
Yes, and the immune system will go out of balance. And I find I linked insomnia with the autoimmune, because they link the nervous system with the immune system. So when they don't sleep more than 5 hours or interrupted sleep, their nervous system is out of whack, and then the immune system also become hyperactive, and that leads to different kind of autoimmune.
Right, and I think acupuncture can be very effective for activating the parasympathetic nervous system, and it's very safe. It doesn't really have any side effects,
Yes,
So
yes.
it's very effective for me for helping, activate my parasympathetic system. And people who have like the most severe cases of insomnia, that's like medication resistant, there can be very rare conditions, or there could be something caused by maybe a virus, like if we talk about COVID or other types of viruses that cause perpetual overstimulation of the sympathetic nervous system, maybe, right? And
Yeah.
then those cases may need to be treated with like a procedure, like a nerve block or something like a stellate ganglion block, which is an interesting, idea to shut down all that sympathetic overdrive that the body's
Okay, okay.
in, right?
So you're mentioning like the nerve block for the ganglia, which the sympathetic nerve come out from what, C7 to T1,
Right.
thoracic one, and there is a device a neurosurgeon invented, and they get FDA approved, but I wouldn't do that. It's like they put something here around the neck, and then they can send a signal to parasympathetic nerves to slow down the heartbeat. And they even linked with autoimmune. And by putting here, the nervous system, the parasympathetic nerve becomes stronger. So the immune system will be slightly suppressed. So the rheumatoid arthritis or Hashimoto can be helped. But what do you think? I would rather say I did a video about this triple warmer 16, at the same level of the angle of the jaw and behind this muscle, sternoclavicle-mastoid muscle. And if you press that, you really feel the sensation in the upper back, the neck, and the jaw. So that one also can strengthen the parasympathetic nerve. I would rather press here every day when I was taking nap, but I had experiences. There's this lady, she had uncontrolled high blood pressure. She was on the medication, and she wants to reduce the medication. So I showed her this point, and because she was on the medication, so her body lose the power to stabilize the blood pressure. So she was sitting there. I told her lying down. She was sitting there and pressed this. She always like lightheaded because it dropped the blood pressure too much.
Yeah, and sometimes that can happen too. People can get autonomic nervous dysfunction, of the nervous system.
Yeah.
So as they get older, sometimes that happens. It's rare, but I've seen it a number of times, and those can be really challenging cases to treat.
Did you ever hear the little kids, they like to grab the other person's neck and pressing here, and then they get like a euphoria, like you pass out for a second.
No,
I heard. I heard.
That sounds very dangerous. So
Yes,
I wouldn't
it
recommend
is.
that.
Yes,
Your carotid sinus is over there, and that can control your heart rate also.
Yes.
So that can really affect a lot.
Yeah.
Of the system.
Yeah. So I think I prefer milder procedure instead of put a stimulator in my neck, and by cutting open your neck, it's another trauma.
Right. Well, you can get chronic inflammation and scarring with any device, foreign body in there, infections. So generally, I'm not a fan of medical devices unless they're absolutely necessary. But I think that they're a little overutilized, and I think a nerve block like the stellate ganglion block is probably safer than doing a medical device implant.
If they are gonna do that, a nerve block, is that in the back or in the front?
So it's right below the back of the carotid artery.
Oh, right below. Okay. Do you think that's
So it's right posterior, I believe, to the carotid artery. But there are individual variations too.
Yes.
So you have to I think you have to go between the vertebral and the carotid arteries.
Okay. Okay.
So, you
Sounds
have to know
like,
what you're doing, and use an
yes.
ultrasound so you can see.
Yes, yes. I think that's, unless you try the herbs, try the acupuncture, acupressure, and that's not helping you sleep or balance the immune system, then you go to another route, right?
Right, and these are like the most severe cases, right? I think most people have issues either falling asleep, staying asleep, or both, right?
Yes.
And then there's different things we can do, like try yoga and breath work, right?
Yes,
and
yes.
acupuncture, and some of these simple herbs like chamomile or American skullcap or
American skull?
American skullcap can help with sleep also.
Okay.
Passion
Okay.
flower, right?
Yes,
There are many,
yes.
and same thing with the supplements. Magnesium, there's a lot of different types of magnesium, right? Like
Yes.
magnesium glycinate, magnesium L-threonate, magnesium taurate, right?
Yes, yes. We have so many choices we have to try before we go to invasive procedure.
Right, right. Everything's risks and benefits.
Yes.
You know?
You have the balance. Thank you.
Thank you.